The temperature is the measure of heat, and heat related to the velocity of the molecule oscillations in the organism, in the case of the physiology. And the more is the velocity of this oscillation movements of molecules, the more is temperature. So hence the more is the intensity of metabolism. Therefore, the increase of the body temperature increases the metabolic rate, and vice versa. When metabolic rate increases, the temperature increases. That's why we will now draw the functional system of the optimal body temperature, and we will begin with metabolism, M, and we will show that metabolism is tightly linked with the optimal body temperature. But if the temperature will be too high, more than 41, 42 grade centigrade, denaturation of proteins may take place, leading to the death of the body. And vice versa, if the temperature decreases too much, then metabolic rate decreases, and it may lead to the stop of metabolic pathways. Therefore, all organisms, living organisms, are divided into several types. We, mammalians, may keep the temperature at the constant constant level, not depending on the temperature of the external environment. And this is called gomothermic type of thermoregulation, in contrast with, for example, with frogs, with snakes that cannot keep the temperature at the constant level. So this mammalian type of thermoregulation that we discuss is a good achievement in the evolution that makes the body relatively independent on the environment. What temperature should we take? We take as an adaptive result the temperature 37 degrees centigrade. But the temperature of the body is different in different parts of the body. We have so-called core temperature. Core temperature, that is the temperature of internal organs, especially in the temperature of the blood in the right auricle and right ventricle of the heart. This temperature is constant, is 37. We have the organs that have the higher temperature, for example, liver, it is 38, because metabolism in liver is very intensive. And we have parts of the body with lower temperature than 37, extremities, for example, and peripheral parts of the body. So we have the temperature of the shell. The shell of the body depends on the external environment in a large extent. It may be more, and it may be higher than the core temperature. So in this case, we, in the functional system, we speak about the core temperature, that is 37 degrees centigrade. This temperature is not absolutely stable, because it differs in accordance with the time. It is the minimal in the morning at 3-4 a.m. and it is highest at 5-6 p.m. This difference is not very high, but it's substantial. And in accordance with the day of the menstrual cycle, the second phase of the menstrual cycle, just after the ovulation, temperature increases 0.3, 0.4 degrees centigrade. And how to measure the temperature? You may measure in auxiliary part, it will be not quite similar with core temperature 36.6. It may be rectal or vaginal type of measurement. It will be closer to the core temperature. Okay, and then in this functional system we should draw the thermoreceptors. Thermoreceptors, which are located in blood vessels and on the skin. The amount of hot receptors that feels hot temperature is lesser than the number of cold receptors in the skin, and cold receptors are placed more superficially. From the thermoreceptors we have the feedback, the nerve fibers that carry the information coded in nerve impulses into the central nervous system, CNS. In the CNS we have the center of thermoregulation located in the hypothalamus. In the anterior hypothalamus we have the center of thermal output. And in the posterior hypothalamus we have the center of thermal production. By the way, in the posterior hypothalamus we have the center of sympathetic nervous system. By the way, sympathetic nervous system increases catabolism, increases the thermal production, and parasympathetic nervous system increases thermal output. So it corresponds with the control of the ANS. So we have a nerve center in the narrow sense, and in wide sense it is also including the cortex, limbic system, etc. Of course. Okay, now when the corresponding center of CNS is activated, for example, if temperature changes, it differs from the optimal level, then the mechanisms of control of the self-regulation are involved in the control of the temperature. These mechanisms involve humoral control, of course, hormones, and it will influence the temperature. It is also including the cortical influence and behavior. For example, if it's hot, you may use air conditioning system. If it's cold, you may take clothes, you may turn on heater. So behavior. But even if you will not do these things, the temperature will be stabilized to a certain extent by the internal link of the regulation. The mechanisms of this self-regulation, of internal mechanisms of internal link of self-regulation, are divided into the mechanisms of thermoproduction, production, and mechanisms of thermal output. So we will discuss them separately. And thermoproduction may be due to contractile muscle contractions and non-contractile mechanisms. So contractile mechanisms, and non-contractile mechanisms. We will discuss them separately. Okay, contractile mechanisms. They will involve the voluntary muscle contractions that belong, as it was already told, to the behavioral type of mechanism. Now another type is shivering. shivering that increases the thermal production at cold temperature very intensively. Shivering is a very good type of thermal production because muscle fibers contract in different directions and temperature increases sufficiently. Another type of contractile thermogenesis is the increase of the muscle tone. So increase of the muscle tone. Muscle tone increases the thermal production very well due to extrapyramidal influence from the extrapyramidal part system, structures of the brain. Non-contractile type of thermoregulation, of thermogenesis, including the increase of the metabolic rate. So here we have the increase of metabolism. So when metabolism increases, the thermogenesis also increases sufficiently. Also, it is involving the processes in liver, glycogenolysis, and the metabolism in liver increases, that giving additional amount of heat. Another type of non-contractile is uncoupling of processes in mitochondria, where the ATP is not produced in this case, and it may take place in the brown adipose tissue. Brown adipose tissue, in contrast with white adipose tissue, is when it is broken down, produces much more heat. Brown adipose tissue produces so many heat because in this tissue uncoupling goes very intensively. So brown adipose tissue may be found especially in children. In children, the mechanisms of self-regulation of the temperature are not well balanced at the time, so brown adipose tissue saves and prevents children from getting cold from degrees of the temperature, body temperature. Okay, it was about the thermal production, and what about the thermal output? There are physical ways of thermal output. For example, we may mention radiation, conduction, we may mention evaporation and convection, physical types of thermal output. And now we will also speak about physiological types of thermal output and the ways how these physical types of thermal output may be realized in the body. First, the evaporation is important type of thermal output. It is done by sweating. So sweat glands they produce sweat, and about 1 liter is normal amount per day, is releases about 580 kilocalories, but in the hot temperature the amount may increase up to 11 liters per day. Also, evaporation may be realized by respiration. So respiration is increased, and it is also a type of thermal output. Respiration. Also, to increase thermal output, the metabolic rate. Which it increases or it decreases in the case when the temperature increases to release heat. Metabolic rate decreases. And another type of thermal output is release of heat with urine and feces. Urine and feces. But this system will be incomplete if we will not mention the reactions of blood vessels. So, in the case if the temperature, body temperature, increases, the blood vessels on the peripheral part of the skin, on the periphery, in the skin, if the temperature increases, the blood vessels dilate, so that more blood is going to the superficial parts of the skin, and temperature is decreases in the body, because it is released into the heat is released in the environment, and vice versa. When it's cold, blood vessels of the skin contract, and the heat is saved in the body. So this is important for thermal output and thermal production. That's why we will indicate is here as the reactions of the blood vessels. Blood vessels, contractions and dilations. So these mechanisms is important both for thermal output and thermal production. So now we observed the functional system of the optimal temperature of that is responsible for the optimal temperature of the body, and now we will speak about some conditions and some situations when the body temperature changes. It may decrease and it may also increase. The hypothermia is the situation when the temperature of the body decreases. It may be artificial, and it is used in medical practice to decrease the metabolic rate. We already discussed it. And in this case, the resistance to hypoxia in tissues increases. So it is useful for operations, surgical operations, for example, on the heart, in cardiosurgery. So the tissues may live longer without oxygen in this case. Hypothermia may be induced by several procedures. For example, ice may be used to decrease the temperature of the organ. Then pharmaceutical agents, for example, the agents that relax muscles. This prevents the contractile thermogenesis and decreases the temperature. During narcosis, usually we have hypothermia, the temperature decreases. Also, we may block the conduction of nerve impulses in the autonomic, for example, in the sympathetic division of autonomic nervous system. It will also decrease the metabolic rate in the tissues and will decrease the heat, the temperature of the organs of the body. And there are the pharmaceutical agents, drugs that will have the central effect, central action, will change the activity of the center of thermoregulation. So they are also used for induction of hypothermia. Another type of situation is hyperthermia and fever. So in these cases, in both cases, the body temperature, the core temperature, what is important, increases. So the increase of the core temperature we have in the case of hyperthermia, and in the case of fever. But they are absolutely different. Hyperthermia is induced by the increase of the temperature of the environment. When person is working under sun, for example, for a long time, So the core temperature will increase gradually or abruptly, and the consequences may be quite serious. The pH of the body changes, and the toxic effect, it may have toxic effect on the centers of respiration, of the cardiovascular system, and may be even lethal if the hyperthermia is severe. Quite another situations is observed in the case of fever. So fever is induced by endogenous factors like pyrogens. Pyrogens are the substances that are released partially by the body. For example, cytokines, the agents of immune systems, or maybe exogenous. For example, lipopolysaccharide, agents of the bacteria. What do? They change the set point of hypothalamus. So normal set point is attuned to 37 degrees centigrade. Pyrogens increase the set point of hypothalamus, and normal temperature 37 becomes low. So person has fever, it has cold, it feels cold, but the temperature increases. So it is adaptive in some respect process that increases the intensity of metabolism and increases the activity of immune system. But if it's too high, more than 37, we should use antipyretics and then drugs to decrease the temperature, because it may be also dangerous, as in the case of hypothermia. So when person is recovering, when it's getting better, the set point decreases again, and at that time, person is sweating. So it's good, because it indicates that set point decreases to the normal level, and the normal temperature will recover.